tooth. And this pain usually starts from the 3rd to 5th day after tooth extraction. And this is the worst pain you can ever have. But how this dry socket happens, let's understand that. What actually happens is that when we take the tooth out, immediately the blood starts coming to that area and starts to form a blood clot. And this blood clot is very important for healing and bone formation. And after some period of time, we get a complete healing. But what if the blood clot will not be formed and it got disrupted and leads to an empty socket? And this usually happens due to certain causes. The first one being if you are a smoker. The chemicals that are in the smoke have a tendency to prevent the blood clot from developing and interfere with the healing process. So definitely do not smoke. The second one being if you are using a straw or some kind of sucking motions, especially while eating the fluids right after tooth extraction. So please avoid that. The third one is if your tooth extraction is difficult. That also induces the high chances of developing dry socket. The fourth one is in females who are taking oral contraceptives. The fifth one is keeping your oral hygiene very poor. And there are the other reasons too which are still under the research. And when we look down on the extraction socket, even after a few days, we will find the exposed bone that is not covered by a blood clot or healing epithelium. Only these small fragments of the dislodged clot is present on the socket walls. And this exposed bone and the nerves associated with it is the cause of extreme pain in dry socket. This empty socket also allows the food that we eat to get deposited right here and causes the foul taste or the foul odor and makes the conditions very worst. So now let's talk about the treatment part of the dry socket. The oral pain medication will not subside this condition alone. You need to visit the dental office, and this is easily treated at the dental office. Your dentist to irrigate the socket with the sterile saline and flush out all the food debris out of the socket. As you can see the enormous amount of food contamination in the socket. After lifting out all the food debris, the dentist uses this dressing material. This is called the alveolar gel. And this is the only top of the line medicament in treating the dry socket. A small amount of alveolar gel is being placed deep into the socket. This alveolar gel gives the patient complete relief from pain and starts working right after it's placed in the socket. And one more good thing about this alveolar gel is that it needs not to be removed out from the socket, as it self-eliminates after a few days. Then small gauze pack is being placed over it for a few minutes to suck up all the fluids coming out from the alveolar gel. You can see after a few days a small amount of alveolar gel is still there, and the socket now fully covered with the layer of healing epithelium. That's very good. And the gum tissue right here also starts healing slowly. This whitish thing right here is the granulation tissue, which is the indication of healing socket. And after 15 days, there is a significant amount of healing of gum tissue and the extraction socket. And it leads the socket to form the natural new bone in the next 3 months. If you find this video helpful, please don't forget to subscribe my YouTube channel, and thank you.